not always necessary. If you didn't put a bolster in a side lie in the exam, it would be more about comfort rather than safety. The importance of bolsters is that your joints are aligned when you apply pressure to them. So in this position, I don't need a bolster because it's nice and flat against there. Okay? So now, you've got your flexor group in this position. And you can massage your way up through here. So this is like additional detail for you guys. This is now going to get into that tibialis posterior. So if Phoebe came for a massage because you're getting pain down the back of the leg, and I send you home with just a gastrocnemius and soleus massage, it's going to do something, but it's not going to clear out everything. Like the tibialis posterior, we need to be able to get through to. But it is largely covered by the soleus. So the areas that you can get to tibialis posterior would be up here, and you need to slide over the tibial border, go deep, and then push in back to the tibia in that way. So there's a few different positions, in and through, and then just friction up and down or compress, and that will start to release in and around there. So I do like multiple compressions. So I'm doing a couple of second compression, and I'm just working my way up the leg like that. Or I might do a friction. Simple kneading is along the grain of the muscle, so just using the tibial border, the back of it, there's a little pinning mechanism. I'm just doing little multiple frictions in an area. So you can get it up through there. What's that look like?
That's fine.
No problems? Cool. There's your soleus. Come just to the distal end of the calf. And then in here, you've got more of your tibialis posterior, and then you've got your Dick and Harry, Tom's already there, which join and they move around the malleolus, go under the base of the foot and all the way down through the toes. So a lot of the times if you're dealing with lower leg issues, it makes sense to follow that massage all the way down and into the foot. Now I might be doing something a little bit contentious in this move. Anyone figured a problem out so far?
Two directions?
Going two directions. One's contraindicated and one's indicated. So the proximal to distal on the limb is not okay, but it's the long sweeping movements that are not okay. So if we were to start in and around the malleolus and do a little move down and around the malleolus and into the foot and follow the flexors all the way down through to their origin, that's a really therapeutic and good technique to learn. But massaging down the leg and around is pushing all of this blood and working against the non-return valves in that direction. So broad sweeping down is bad, but specific simple kneading frictions or deep epluage in and around an area, flexors and tendons, is definitely a good thing to do. Yeah, I'll just follow that down into the foot, and I could follow that with a more stuff. I mentioned I can pin him in dorsiflexion. So as well, that stand introduced using your body as a tool in order to do your massage. In this, we could just use the bolster and your weight of your foot. Now I've got you in dorsiflexion, and we can get that Achilles, and we can work into the Achilles a little bit more in there with some simple frictions. And that just means you're in a better position in order to friction. Can you feel the difference between the two, or does it feel the same?
I think it feels similar.
Feels the same. Quite nice in this one is I teach you a lot of stuff that's starting to prepare you for level 4. So mobilising the joint is kind of all level 4 stuff. So now I can use my leg to mobilise the joint and just start to introduce movement into an area which is lacking in movement and is quite painful. So now I'm doing some soft tissue release in and around the Achilles. I can't show you that yet, but it's just a lot of the stuff that I teach you might not necessarily feel the best body position, but when you start to move through, they become really useful. In Achilles problems, you get lots of puffiness and fluid build up in and around here, so that kind of access to the medial malleolus and working in this type of way is a really nice way of introducing movement. So I've given you Achilles, tibialis posterior, and the flexor group in terms of compression, simple kneading frictions. I'm conscious that I don't want to overload you with stuff. So would you like to find those areas on each